available. Professor Popelansky investigated this pinpoint localization of pain through histological study utilizing electronic microscope as well isotopes, and come to conclusion, absolute conclusion, that this pinpoint localization of pain are suffering from ischemia, means demand of blood supply to these cells much higher than available. Now, trigger point therapy is basically ischemic compression. What happens when we will detect where is this pinpoint localization of pain? We will start, and as you can see, the tip of the finger is area is bigger than this very millimeters of these points. You find this trigger point and gradually start compressing. You're compressing to the point until you reach the threshold of pain. More, you don't have to force. You feel it's pretty painful, but have to be painful, like Chinese calling this kind of pain healing pain, and not to wake protective muscular jump. It's kind of pleasant even pain. And first 10 seconds we're holding like this. Now, what happened under tip of my fingers? I practically stop blood supply to these points that already used to suffer from insufficiency of blood supply. Around my finger, by nature, arterial blood flow under pressure and start accumulating. I obstruct the supply to this point, and arterial blood start accumulating around my tip of the fingers. Vasomotor centers worry about total obstruction of blood supply and giving orders to vessels to dilate. And now look at combination. Vessels under my fingers dilated, and a lot of blood right now accumulated around my fingers. After holding like this 10 seconds, threshold of pain usually increase significant, and I will compress a little bit more to the second threshold of pain. Actually, we're getting to the button of trigger point, and I will hold that for additional 20 seconds. When totally 30 seconds of compression will be done, and you in your heart can count 1, 2, 3 to the 30. And again, please imagine what happened under my tip of the fingers. A lot of blood accumulated, a lot of vasodilation and fast withdrawal, blood rushing to these trigger points, and eliminating this ischemia, balancing demand and available supply of blood. And after this mobilization of muscles that leading to relaxation or restoration of normal resting tone within muscles is crucial. And of course, you saw my presentation on trigger point therapy, ischemic compression, and this 10 seconds, not to overdo the pressure, to communicate with patient, to edit 20% how the mechanism, how this is working. And it is important adequate treatment, something that absolutely have to be additional to understanding that by regular mobilization we cannot release fascia. It have to be addressed by special techniques due to the fact that fascia fibers cannot constrict. We have to understand that trigger points, this pinpoint localization of pain, usually development of this point happens secondary and lately due to the dysfunction of fascia and muscles. And let's say if you will do adequate, but have to be adequate compressions, they have to be adequate, and we have to address all of them and to eliminate them. But if previously fascia tension will be not released and muscles will be not stimulated to relaxation, and let's say we will inhibit these trigger points, we will restart them again, which is absolutely not healthy. And I mean, all trigger points have to be addressed. Acute trigger point, latent sleeping trigger point, satellite trigger point, very important. Existence of these trigger points, and usually any segment, injured segment, carry between 3 to 5 trigger points. They all have to be addressed adequately and have to be eliminated. But the cause, the secondary developing the trigger points, have to be addressed, and this is dysfunction or tension, excessive tension within fascia and muscles. Thanks.